Well, good morning, Bonnie. How are you doing today?
Good morning. I'm good, Andreas. How are you?
I'm doing well. I'm delighted to be here with you as always.
Oh, I'm very happy to be here too.
Yeah, and we're facilitating tomorrow together, right?
We are.
Yeah,
We are.
yeah,
Veteran.
yeah. I'm looking forward to it. A veteran.
Yeah.
Yeah. Well, that's what we're talking about today is veterans program. And you want to tell us a little bit about who you are and what you do and why you're doing this?
Sure. I was an anesthesiologist in a prior lifetime for a little over 30 years. I retired in 2019, moved to Ashland in 2020, started facilitating in 2023, which seems to me like a natural extension of anesthesia, watching one person in the dark for long periods of
Mm.
time. I have a special interest in veterans. I was in the U.S. Army Reserves for 10 years, and I think veterans deserve our support. So,
Yeah.
veterans are one of my primary clients that I try to facilitate for, and it is my great honor to do that.
Right. And, as Satya, we've tried to support veterans as much as possible.
Yes, Satya lowers their prices for the rooms as well as I lower my facilitation cost for veterans. We
Mhm.
have a $900 all inclusive program just for veterans. We don't generally go down that far for anyone except for veterans,
Yeah.
which it is again, our great honor to offer that.
Yeah. Is there any specific experience that led you to want to do more support for veterans?
Well, in the reserves, I spent time on a lot of Army bases, did a lot of training in San Antonio, where I worked for a long time at Camp Bullis or BAMC there in San Antonio. So I met a lot of people who are all active duty military, and I had have a lot of respect for those individuals. And there's a lot of places all over the world who are catering to veterans with PTSD and depression um, that are out of this country. We are located in Oregon. Um, with you don't need a passport to
Mm.
come and see us,
Hey.
and it's very safe. You're in a sort of clinical setting, very controlled environment, and one of my specialties is veterans. So
Right.
yeah.
I think this month, you generally do 10, 12 people a month, and I think this month it's 9. Is it 9? 9
With
veterans?
10 clients and 9 veterans, yeah.
That's amazing. I mean, that's
It's
huge.
unusual. I don't usually do quite maybe half of my clients are usually veterans, but
Right.
this month is
Right.
it's, almost all of them.
Right. What are some of the things that people are coming to you for?
Um, mm, Depression, anxiety, a lot of them do have a lot of PTSD from, a warrior, uh, ethos from actually being in combat. Um, some of them do not, but they still served our country, so I don't care whether they had a war experience or not. It's an honored thing, uh, as a veteran, whether you stayed in the United States or went overseas. Um, Mostly PTSD, depression, anxiety, almost always.
Right. And, sometimes you and I are in the room together, sometimes not. We want to talk a little bit about how that works.
Yeah, so, 2 facilitators together, in particular, 1 male and 1 female, is a really good balance of energy, whether it's a female client or a male client. It allows, both sides of energy to be in that room. Sometimes clients who are really complicated, medically or mentally, um, I ask Andreas or he asks me to be present in the room while we do these journeys. Sometimes it takes 2 people to handle the things that
Mhm.
might come up. Um, Sometimes he's in the room or I'm in the room are really not needed, but it is really a, a balance of energies going into that. And the person gets 2 preps. They get preps from me, they get preps from Andreas, they get integration from me, they get an integration from Andreas. So
Mm.
it's a nice way to handle that.
Yeah. What are some of the things that people bring up or concerns they have or fears they have heading into the preparation and into the administration session?
Um, Oftentimes it's loss of control. That seems to be the biggest issue for veterans and non-veterans. not knowing what one will do under um, the effects of psilocybin, whether it is fear of losing your emotions, fear of becoming aggressive, fear of wanting to run away from the situation, fear of getting nauseous and throwing up, fear of the unknown is essentially.
Mm.
Um,
That's pretty normal for everybody, right?
Everybody, nobody knows
Even
where.
you, maybe?
Yeah, even me. Yeah, I probably don't get nervous anymore so much, but I did.
Yeah.
I remember. I hit the microphone. I
Yeah.
remember my heart racing first couple of times I did psilocybin.
Yeah,
So
yeah. Just so everybody knows out there, it's very normal to resist and to try to keep control. And even when I go do a journey, I'm putting on my full armor
yeah,
and asking the mushrooms to be nice to me. So, you
yeah.
know,
I mean, I do describe it to clients as a roller coaster ride, hands up in the air, and don't grab on the bar that the ride goes by because you can't get off the ride until it comes to a full and complete stop. And that's going to be somewhere between 4 and 6 hours at a minimum. So
yeah.
it's not um, an easy 4 to 6 hours. It is usually beneficial, but I would not describe it as fun or unicorns and butterflies. It is not
Mm.
that.
Do you think there's anything from military culture, and I mean, there's many military cultures that comes up that might be different than typical prep or typical clients that aren't military?
Yeah, I think there's two things. One is veterans have faced things that the rest of us cannot even imagine. Oftentimes, they're put in situations
Mm.
that they fear for their life or they fear for someone else's life. That's not a normal circumstance for most of us. So veterans kind of have that I can do this attitude and come into it probably with less fear than other clients.
Mm.
But there is another side to that. Um, Sometimes that warrior ethos makes veterans want to do the maximum amount of psilocybin they can ever possibly do within the state of Oregon, and that is 50 milligrams. Psilocybin is one of those things that more is not always better.
That's right.
Um, the higher the dose, the more the side effects, the more loss of control, if you have any control to begin with, the more chance of nausea, the more chance of a anxiety period after your journey that could last for a week or so. Just higher the dose, more side effects. Uh, all of the studies, it doesn't matter what study you're looking at or what country you're looking at, they're all done on 25 milligrams of synthetic psilocybin. That's psilocybin made in a laboratory, not grown from the beautiful organic mushrooms that Andreas grows.
Thank you.
Um, and it's synthetic and it's 25 milligrams. Johns Hopkins has gone up to 35 milligrams for people with long standing treatment resistant depression. And that is as high as any studies that have been completed. There are some studies currently going on that go up to 40 milligrams for a variety of things, but they won't be finished for a couple of years, would be my guess. So 35 milligrams is the highest that's been studied. We do go up to 50 milligrams. We have, Andres and I together, have had a few clients who ended up in the emergency room
Right.
for loss of control or maybe aggressive type behavior. Those journeys were beneficial, particularly to the one who was the most aggressive. But it was a really tough day for him, and he ended up in a hospital for the
Yes.
evening. So that was a complicating factor for him, but it worked out because he had a good result.
Mm,
So.
mm. So, you know, when we talk about veterans, we talk about people who have gone through disciplined training, gone through very difficult times, a lot of strength there. What kind of strengths do you see veterans bringing to journeys?
Well, as I mentioned before, mm, they can take it. They're not they're not someone who's going to fold under pressure, generally speaking.
Right.
Um, they do, and I do tell veterans, psilocybin is not the grog bowl, and that's a military thing of toasting and drinking all of your drink before you can put your glass down. They don't have to chug the psilocybin. I would prefer that they not think it's
Right.
tequila and they drink it really slowly and thoughtfully.
Sometimes it does happen that way though, right?
Sometimes they have downed it before I even had a
Yes.
chance to look up, so I do in prep, I say, "Please drink it over 5 to 10 minutes," but people are nervous. A lot of
Right.
times they just "Conk," and it's down.
Yeah. You know, the aspect of trust, Bonnie, is huge in this process. And sometimes people, not just veterans, but people have a lot of painful memories and maybe things that they're ashamed of or things like that. How do you approach that?
Mm. Uh, mm, I approach it with quiet. I talk to people about what the experience might be like. It is impossible to put into words what a psilocybin journey is like until you have done a psilocybin journey. You really don't understand what that journey is like until you're in it or you're finished with one. So when people are having a lot of anxiety, I may do deep breaths with them with their hand on their chest. I may hold their hand. I may sit beside sort of close to the bed so they feel my presence. I'm always in the room, never ever leave the room. But my goal is to be completely non-obtrusive. So whatever they're struggling with, if they say, "Body, am I dead?" I will say, "I don't know. Tell me what you think." If they say, "Am I safe?" I'm gonna say, "Yes, you are safe." But I'm not going to try to influence the direction of their journey whatsoever. I try to be as quiet as I can possibly be in the corner and let them
Mm.
experience this. They can look over and see that I'm still there, but I don't try to direct that in any way.
Yeah, I think what you talk about safety, I think everybody should know out there that in the space that you're in here in this building at Satya, you are 100% safe. This is the safest place I think you could be. And also, there's an idea of acceptance and normalization. However you behave, assume you're not going to hurt yourself or other people. It's totally normal and it's expected of you. And we're very accepting of
Judgment free.
people's, yeah, we're judgment
Judgment
free.
free.
There's no doubt about that.
Yeah, people can scream, they can cry, they can laugh, they can move, they can vomit. They can do all kinds of things to expel energy from their body. We don't care. We want you to get the emotions and feelings out of your body so that you don't have it stored and kept in your body any longer.
Right. That's super important. A lot of people that come visit us have done a lot of research about psilocybin and they know about it and they don't really have any misconceptions. And then there's some people that do have misconceptions about psilocybin. It could be upbringing or,
Mm.
whatever. Do you see any difference in misconceptions maybe that some veterans might have about psilocybin and what it's about?
Well, there's a lot of people still see not Richard Nixon's, Ronald Reagan's war on drugs. So this is your brain on
That's
drugs.
Nancy. Nancy helped
Nancy,
us
yeah,
with that,
Nancy
right?
did, yeah. A lot of people see that commercial and they think, "Oh, I'm not gonna, I can't do drugs. That's bad for me." Um, the literature and science is moving that forward so that if you pick up most any kind of journal, doesn't have to be scientific, an article about psilocybin will appear if you just look long enough. It's very easy to Google now. There's lots of information. Psilocybin is the safest of all hallucinogenics. Um, you cannot really overdose on it. You may think that you've overdosed, but it's just the length and the intensity of the journey that will eventually end. It's extremely safe. Unlike ibogaine, which people do going to other countries, mostly there is a study that's about to be set up in Texas for veterans using ibogaine. But ibogaine is cardiotoxic and can actually stop people's hearts. So I don't encourage people to go do that unless they do it in this country with a physician present. Um, Psilocybin is much safer than that. Ibogaine is really good for PTSD, but it has some risk.
Right, right. Talking about risk, whenever there's risk, there probably needs to be trust. How do you view trust in this entire process?
Well, I think most people who come to see me, the vast majority do so because of the MD behind my name. It gives them a feeling of being safe. I can tell you that you're safe with most anyone who has experience doing psilocybin because the medicine is so safe. Um, I do a lot of clients who are on a lot of different medicines and have some medical complications along with it. So it's good. My background is really helpful in that, but it doesn't. You don't have to have that MD behind your name to do this. People are very qualified and very experienced, particularly here at Satya, um, to handle all kinds of clients. The MD does make people feel safe, um, but it's not necessary by any stretch.
Right. I always view trust, and the way I describe it to clients is you don't have to trust me that much before we go in. You don't have to trust me that much afterwards. But you shouldn't go into the room and have a session with me unless you trust me for those 5 or 6 hours, and I can assure you I'm 100% trustworthy, and so is everybody else here during those 5 or 6 hours. But the reason we say that is if you start to struggle or have a difficult experience and you don't believe the words coming out of our mouth, that's problematic because if you won't believe it, then we can't really help you. So I think it's very important as you form that relationship with the facilitator in prep that you consider, do I trust the person? And you will, of course you will. I mean, I don't think we ever go into sessions where people don't trust us, but
No.
it's something for you to consider. You just have to really trust us during that 5 or 6 critical hours.
Yeah, I mean, but even if people trust us, the words coming out of our mouths sometimes do not land.
Right.
They don't really understand what those words mean, or either they're just feeling too anxious to absorb them. So, um, yeah, it's it's a little bit of an unpredictable business.
Absolutely. Every journey is different,
Every
even multiple journeys, and
every
it's hard to predict, impossible to predict how people will behave. That being said, there are some common themes across journeys. I know we could talk about one, which is continuous talking. That's one theme,
Mm.
right? But what are some of the themes you see, and how do you relate to those?
So we'll talk about continuous talking. So people who talk, I don't think there's anything wrong with
No,
talking,
no.
but I do think often that talking is a method of distraction away from what the journey is trying to show you. So I will often say, ask the client, I wonder what would happen if you did not talk for a bit and just went inside to see what you came here for. Because talking is it's just an energy release, but it can also be a distraction. You're distracting yourself from wherever the mushroom is wanting to take you by talking to me. And so you didn't come here to talk to me. You came here to talk to the mushroom. So I do try to get people to be a little quieter and to go inside. I do keep a journal for people while they're on this journey. Sometimes when they're talking a lot, I'll just put my pen down and quit writing because I really want them to go inside. That's
It's
why
not a
they're here.
cramp.
No, it's not. It could be sometimes, but no, it's not a cramp. It's just some of the things people say, I think, oh, they probably don't want to read this later, and I'll just stop writing. But I do, the object is to go inside. That's why you're here. It's an internal journey. It's not a entertain Bonnie journey or an entertain Andreas journey. It's a internal journey to heal whatever wounds are there.
I think that's really well said. And what I would say is that if you do talk the whole time, that is could be perfect
Okay.
and normal and it's okay. The misconception that I see a lot is people watch YouTube videos, documentaries, and all these things, and client is laying here with the eye shades on, smiling,
Really
and
quiet.
you have a calm facilitator, and it looks idyllic. And maybe my experience is that's 1 in every 10 people. So whatever you're doing is fine. And if you are talking, that's fine. Remembering that the reason you come all the way out here and spend the money and the time is to go inward. And usually that's best accomplished with eye shades and with silence. But if you can't handle the eye shades on, and many people, it's too intense, that's totally fine.
Yeah,
Right.
I would say the majority of people can't leave the eye shades on.
Oh, no.
They rip them off and put them back on, rip them off, put them back on.
And that can be really beneficial. And even if you put the eye shades on the last half hour,
Yeah,
that could be huge.
very, very beneficial.
Yeah, yeah. Do you, see that this work, and this is a tricky question from the state standpoint, but is there a difference between trauma-related work, depression-related work, and anxiety-related work when it comes to psilocybin?
That's a good question. Uh, and I don't think it's really my business to decide about those things. I think that's psilocybin's job.
Right.
Whatever the person comes with, the medicine is here to fix that or to help them with that. Nothing that I do will change the directive of that journey. So,
Mhm.
have you ever heard the book The Body Keeps the Score?
Yeah, it's on the shelf over
Yeah,
there.
I truly think the body keeps the score, and
Mhm.
where we store traumas, memories, things that have hurt us in the past, psilocybin is really good at finding that, and it
Right.
just trickles up over 4 to 6 hours for you to take a look at.
Mhm.
I don't really have anything to do with that. My job is to keep you safe in the space that you're in, to let you know that I'm going to keep you safe in that container. It's not to worry about whether you have anxiety, depression, or anxiety. That is all the medicines. Um, the medicines.
We don't get involved in that at all.
No.
There are some facilitators in the state that are now allowed to practice their special field of, let's say, trauma-informed work because they're a therapist. But that's our role is to be non-directive and to allow, like you said, the psilocybin and the person to relate to that, and
Yeah. I'm
that's what works things out.
Yeah, I'm not a psychiatrist, I'm not a therapist. I'm a retired, uh, doctor who does this, who I feel it is my calling to do this. I think this is why I'm on the planet, is to offer this medicine to people, and anesthesia was a preparatory, time to be ready for this. So I'm very comfortable with
Mm,
clients of all different walks because I know for the most part I can really keep them safe in that space. Now, if it's somebody I'm worried about, then he's sitting in the corner to make sure that the energy is balanced and that we have 4 sets of hands or 2 sets of hands if I need
mm.
help in that room.
I think I wanna elaborate on that if you're worried about because that really needs to be, I think, clarified. I think what worried about means that, sometimes during a session, a client can have a transference
Yeah,
where you become a symbolic of something that you're not.
yeah,
And so in that case, transference can sometimes get very tricky. And by having someone like me in the room, a male as opposed to a female, the transference might not be happening to me. And so at that point, I can step in and, we can minimize, Bonnie is no longer the wicked stepmother,
yeah,
so to speak. And that's just an example.
no, yeah,
And all of a sudden, maybe I'm the heroic father figure or whatever. Or it could be the opposite. I could be the abusive father in your mind. And then Bonnie is the person that counteracts that. So it's more a matter of when we say worry about, we're concerned about the client's best interest and meeting the need of the client's best interest.
yeah. I mean, it's things in particular I look for. I have a questionnaire that goes out as the first thing to set up a journey and um, underlying issues of rage or anger, memory loss. Do you feel like you've come to terms with all the traumas in your life? If someone answers no, and they have not worked through the problems they have, if they do have memory losses or they drink a lot or take other drugs, those are all kind of red flags that make me think this person could um, get
Be
mm,
more difficult.
be more difficult or be not as rational under psilocybin as some. So I have a tendency to then try to balance that energy. If it is a male, if it's a female, which Andres has also been in the room for female, it's also the same idea of balancing that energy to, if you need help, someone's in the room rather than not.
Exactly. And, this brings us to a topic that we could talk about for hours, which is difficult experiences. And I think maybe before talking about how we handle difficult experiences, maybe talk about what maybe some of those kinds of themes are that are difficult for people that come up over and over again.
Something that's difficult, but that people often look for or come here for is um, a spiritual death. They want to be reborn by psilocybin. It does happen. I would say maybe 20% of the time that is the outcome of psilocybin. Um, in my experience, it seems to always present, sorry, I keep hitting that, respiratorily, or people don't think they can breathe and they feel like they're suffocating, and then they'll get really quiet. And they're still breathing, but they're very, very quiet, very, very still.
Mm.
And for maybe 20, 30 minutes, and then they slowly start coming back. Um, I've had clients who thought they literally died and that the morgue came in and took their body out. But then they realized that they were still in the room even though the morgue took their body out, which is a whole other conversation. But
Right.
um, that's one of the most common. Um, People worry about urinating or peeing in their pants. I think that's almost 100% of people who worry about that.
They worry about it more than we do.
They worry about it a lot more than we do. I've maybe
Right.
had 10 people out of 300 who that has happened to. You cannot hurt anything in the space. It's all prepared in case you do have that. And it's nothing you can control. It's just sometimes people get too deep. They don't. The idea of going to the bathroom doesn't make sense, or they're not physically able to stand up and get to the bathroom. So they just give up and don't. We don't care. It's just another thing that happens that we are well prepared for. But that's probably the most common thing I think that people worry about is that.
Yeah, I think one of the really big ones is after 2 or 3 hours of learning a lot, they people have had enough learning,
Really tired.
and it's time to go home, but they are not on the way back yet from wherever they are, and they start to their default mode is reconstructing, so this is not right. I can't operate like this in my job next week, and you're right, you can't, and you won't have to. So it's that idea of not coming back soon enough causes a lot of anxiety.
Yeah, there's no off ramp. Particularly as you if you increase the dose, the journey lasts longer. And so I've had a number of clients lately who have all done 50 milligrams. Every single one of them, except for one, was like, "You've got to make the stop. I'm exhausted. I can't do this." And I'm like, I can't really help you. You just have to wait till this is done. Get back in there and do the work." It's exhausting. They're really tired, but there is no off ramp.
No, and so what do we do when people are struggling with that, which could be high anxiety, is we reassure people.
Yeah, it will end sooner or later. Sometimes I'll say it's been 4 hours. You have 2 more hours probably before you feel more normal, and give them sort of an idea of, okay, it will end. You promise it will end. Yes, I promise it will end. But
And we get back to the trust issue.
yeah, it's
If
it's
we're
really
telling you you're gonna be better, you promise you you're
yeah,
coming back, and you don't believe us, well, that's gonna be
yeah,
tough on you.
yeah. Well,
But you will come back.
you will come back.
Yeah,
It's
guaranteed.
a matter of science.
Guaranteed. What do you think about integration?
Oh, I think it's one of the most important things of a journey. I personally have had about maybe 4 or 5 clients who did not do integration with me. I will not facilitate for you again if you do not do integration, because that sort of tells me that you haven't really accepted your responsibility of this medicine. It's not a magic pill. Um, I tell people if you're going to have someone rewire your house, it may take a month to rewire your house. I think your brain's pretty similar. This medicine goes on for 5 or 6 weeks, working neurochemically in your brain. Integration is part of that. What experiences have other people had? What does science tell you about what you can do to help with integration? So, most of my integration is all science based by studies, but it also has a spiritual, non religious, but spiritual component to um, help people love themselves, to treat themselves with kindness. I think integration is not as important as the psilocybin. Psilocybin can help people, I'm sure, without integration, but I think it makes a big difference, huge difference.
Absolutely. Absolutely. And we all have different perspectives in the way we approach integration. And I am very practical about it. I think the prep work and the integration work to me are the same thing. And I see the entire process here as a metaphor. You prepare for things, you go through the experience, and then you do what went well, what didn't go well. That's kind of my approach to integration. I don't offer people, oh, here's what this means and that. No, no, for you to figure out.
Well, I do talk about the default mode network. I mean, I do spend some time on that and what is the purpose of that, structures in our brain, what does psilocybin do to that? And so I do spend a fair amount of time in
Mhm.
preparation and in integration on the default mode network.
Well, you actually give lectures on that to
Well,
a
I have.
training program
I
because
have
you're a
in the
doctor and an
past.
expert at it.
Yes,
So
I have done lectures in the past
you you are able to bring a lot of authority to
to
that
take the
topic.
neurobiology. Yeah.
Yeah, me, not so much.
Well, so
What kind of advice do you suggest for people if they're thinking about pursuing this as a veteran? If they're like doing the research and looking into it.
yeah, I actually had one of my clients for this month reach out last week and said, I want to know, what should I be reading? What should I be studying before I came? And I said nothing. Just don't look up anything else. You've done research already. Don't spend the next week trying to prepare yourself intellectually for this journey. Just be kind to yourself. Try to relax. Have a nice week, and you'll be here before you know it. But I think sometimes just reading so much literature, people think it gives them the information that they know exactly what the journey is going to be. You will never know exactly what the journey is going to be. When I journey, every single journey is completely different than the ones before. So there is no way to intellectually prepare yourself for this journey.
What would you suggest to loved ones? What kind of questions might they have, or what would you
Oh, you
suggest
mean
to
to
them?
not my loved ones, but the
No,
client's loved
yeah, the
ones.
clients, yeah.
Oftentimes, I will have if the client is interested, they bring their partner onto the Zoom meetings with us, and I answer both of their questions at the same time. And oftentimes, integration, the partner will join them for at least one of the integrations. So I answer their questions as well
Mm.
as the client's
Yeah.
questions.
I find that more rare that the partner is on the call. They're certainly welcome. I think it's extremely helpful, and I think the most important thing is if you're doing this, that you're gonna go back to a place of support. And if a partner you have, a loved one is concerned or has reservations, I think it would be very valuable to gain a little bit of support and quote buy-in to the process. And that's where it can be really helpful to talk to us. So we're always available to talk to people, but we also will maintain the confidentiality. Whatever happens one-on-one without the person there, we're not going to talk about that, right?
Yeah, the partner is only there with the consent of the client.
Exactly.
Yeah.
Exactly. This is a totally 100% confidential process. Um, what would you say we didn't talk about today that we should talk about?
I want to talk about the city of Ashland.
Well, you go ahead and talk about the city of
Um,
Ashland.
what is special or what is different about coming to Ashland to do psilocybin versus going to Denver or going to Portland or whatever
Right.
large cities you can? Ashland is a very small community, 20,000 people between two mountain ranges, the Cascades and the Siskiyou Mountains. It's a valley between those two. Uh, it is a very peaceful and quiet town. It does have the longest running Shakespeare festival in the country. It runs about 9 months of the year, so the town is a little more active during Shakespeare. But when you leave the journey, you're going back to a hotel that's in a small town with lots of really good restaurants, interesting little places to walk around. We have a 93-acre lithius park, which has Japanese gardens. It has trails and identifies trees, and it's an absolutely beautiful city. And the difference to me is when you come out of these journeys, if you're in, I'll use Denver as an example, you're in a big city with lots of traffic and people moving and honking horns and lots of noise. I do think that affects your ability to go inside and integrate this medicine for a few days after the journey. So I think going back into chaos after a journey is a hindrance. And Ashland allows you to just take a deep breath and go to the park and lay on the grass. It's just quiet and peaceful. And if you believe in energy, Ashland's energy is really good. It's like Sonoma or like Santa Fe. The energy is peaceful here.
It's amazing.
It's like living in a
Right.
Hallmark card. I mean, my clients tell me that all the time, and it's true.
Yeah, I agree. All right. Well, if you are ever considering a journey here at Satya, just give us a call. I'm always happy to talk. You might be talking to my wife, Jennifer. Delighted to answer any questions, and certainly want to make sure that we do the best we can to serve more veterans,
Yes,
right?
absolutely. It is truly, I know I said this a couple of times, but it's truly an honor.
Absolutely.
So,
Absolutely. Well, Bonnie, thank you so much.
my pleasure.
Yeah. Let's